Hey, good
Good
morning.
morning.
How are you?
All right, and yourself?
I am well. I am well. Living the dream. Living the dream.
All right. So, you getting enough rest with the
I
new
am.
addiction? Okay.
That first day was rough though. Well, the day of delivery was rough because we thought she was coming on Tuesday and she did not. She was like, I'm coming when I'm coming. And so she came Wednesday afternoon. So that day was rough. But other than that, yeah, it's been good. It's been good. She's
Good.
adorable. She's so much fun. Her personality is already shining through. Like, okay, I've seen you before. All right.
I've
How you been?
been all right.
Yeah, MIA. We ain't seen you in a month of Saturdays. Good, good, good. How's the weather?
Cold.
It's cold. Yeah, it's cold at home too. It's still a little. I still get a little sunshine here. I think it's like 50-ish every day, but it starts out cold. It starts out be frosting, so it starts out cold.
It's
All right.
23 right now here.
Oh, bless your whole heart. Bless it. Okay. I'm sorry. I'm so sorry. Did you get snow? So I saw somebody
No.
post about some snow, and I was like, "Oh, they got snow." And then my friend was like, "I saw that same post. That snow was gone in an hour." I said, "Oh, it was just a little quick dust in there, huh? It wasn't for real, for real." All right, all right. Well, let's get this party started here. Well, welcome everybody. Welcome, welcome to the Saturday morning tea. Here we brew up the hottest topics in healthcare. We discuss health information, news, education, certification tips, entrepreneurship, lack of sleep, the weather, all of the things. But basically the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I am the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. And let me ask, do you do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co-host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, hey, all right. So, if you are interested in more information about the 5 steps to become a certified marketable medical coder, check out the video description for the link. And let me just tell y'all before I jump in with my partner in success. Welcome to the Instagram, folks. I'm playing around out here in these internet streets, and so
Okay.
I've added. I found out a way to do this, so I see y'all over there. So we here live on Instagram as well. So welcome to the Instagram, folks. Welcome, welcome. You're in for a treat. One way or another, you're in for a treat. All right. So joining me today is my partner in success, my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for 3 decades. In
All right,
2014,
decades.
yeah, in 2014, I left the bedside and transitioned into HIM. During the pandemic in 2020, I created my company, the Coding Nurse LLC, where I help nurses, and other people in healthcare with a clinical background transition into the wonderful world of HIM.
All right, all right. And how is that going?
It's coming along. I have a class starting in January, so I seem to have, I guess maybe because it's the holiday or it's the end of the year. I guess I'm getting a lot of traffic now because I guess people are trying to set their goals for 2025. And I just, it never ceases to amaze me how much information is not out there about our industry
Mm-hmm.
and how much people really don't know about HIM and how
Mm-hmm.
to find their place in it.
Mm-hmm. Which was why I felt like today's topic was so timely. Um, and the twist that I'll be kind of parlaying on the topic because yeah, all of those things. And it is at that end of the year where people are reflecting um what did I do? What didn't I do? What should I have done? Da 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 da. And making the plans for what the next step looks like for them. And so maybe here's an opportunity if you and we are definitely going to dig deeper on this one in our meeting after the meeting because I got some stuff to show y'all specifically related to this topic. So, all right, all right, all right. Well, good, good, good. So, before we jump in, let me remind you that you can join in and add to the conversation. Yes, you can. Don't be shy. Your opinion matters and is welcomed here. So, friends, please use the chat. And if you have a question, put a Q first so that I know or we know that it is actually a question for us and we don't miss it. And you're not just talking amongst yourselves. So, again, for those who are just joining us or watching the replay, today we are talking CIAs, your healthcare compliance golden ticket. But first, let's get into our church announcements. See, I'm so sad. That's gonna be the first thing I do when I get back home. Oh, hey, 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 hey. I should have a church hat. Maybe I'll start bringing my church hat. How about that? And I have plenty of those. So,
Or a little Saturday morning tea fascinator.
hey, there you go. Wait a minute. I'm going to have it all decked out. I love that. You don't put a little idea in my spirit. Don't get me started. All right. All right. So, my first church announcement, and it's I'm kind of speechless. So we all know, if and everybody I'm sure has heard about the unfortunate incident with the United Healthcare CEO who was gunned down broad daylight going to one of their investor meetings. Um, and it was a big manhunt for um, the gentleman who did the shooting. And this is not funny, and I'm sorry. So I heard in these internet streets that he was found in a McDonald's, and somebody said, and of course it was on a podcast where sorry, it's tongue in cheek all day. It was like, so he must have pulled his mask down while he was eating on a hash brown, and the McDonald's employee recognized him and called 911. The crazy part is there was a ransom of sorts if you saw him call this number, da da da. Well, because she didn't call the number, she was not eligible for the money. Who does that? They need to just give it to her. She called somebody, and because of her call, y'all got him. So why wouldn't you give them? I think that's just horrible. And
That's
then
that.
I heard she actually got fired.
That's why you don't snitch.
Well, that is a different spin. Or if you go snitch, make sure you snitch it to the right folks so you can get your coins. I don't understand. But then she got fired. Like, in
But
my understanding was she was like a little old lady, lost her job because now she's a liability to McDonald's and they nervous and scared. Somebody might come in and get them. I don't know.
and
I
but you
wow, that just
well
made me
you
feel bad.
you know since it came out that they found the McDonald's, and they have been people have been giving them like 1-star reviews. It's just been a mess.
The unfortunate backlash of all of the things that happened as a result. Oh my God. I was like, you are kidding me. When I heard about that, I said, that's so sad. But I mean, to your point, he turn the blind eye, get that man his hash brown and keep moving. I don't know. Just
And that was here in Pennsylvania, right?
so I'm shocked. Cause the way we was interacting with the people, they not playing with y'all. Everybody busy and their eyes are straight and they doing what they do. So
But see, this was out there in what like considered Western Pennsylvania, like Altoona.
okay,
So
this is different. This is different.
yeah, the name
Different
says
world.
it all.
Oh my God, I miss this laughter. Okay. Well, that was really the only church announcement I had. I just couldn't believe it. And you've already sort of given your church announcement. So if you want to reiterate on your church announcement again, feel free.
I have a class that's starting Tuesday, January 7th at 6 p.m. Eastern time. So it's just
Are you still taking people? Where can they find
yeah.
the information? Okay, well,
You can
sir. Oh my
you
God.
can go to my website, decodingnurse.com, for more information, or to send me an inquiry to find out more information.
All right, all right, all right. Well, let's see who we got in the house. Good morning, Renita. Good morning. What'd she say? And she lost her job and will not get the $60,000. Right, right. This is horrible. Good morning, Tanika.
Good morning, everybody.
Hey, hey. She said, true story. It's the other CEOs on the face of every corner for me. This is crazy. I still every time I hear some additional rumblings about this, I think about you and your theory related to this, and so I'm waiting to hear for real that bomb drop because there's still a bomb a ticking. So
But what I have found interesting about the entire thing has been people's reactions, the public, and then also mainstream media, because the thing the disconnect for me is how mainstream media is so willing to talk about how violence is never the answer, but there have been some people who are not a part of healthcare who are saying that to deny someone care is violence, and that's
mm,
true.
it is true, especially when you have an oath to the contrary. So yeah, it's interesting. It's interesting, and folks, oftentimes, and I don't know if it's just because they have to stay on script and do, they doing they quote unquote. Oh, let me get rid of the banner. Doing a quote unquote job. I don't know. But when it knocks on your door, then you have a different conversation. You have a whole different conversation.
Yeah.
Mm-mm-mm. Lord. All right, y'all. Well, let the tea spilling begin. So let's dive into a topic that's creating huge opportunities in our industry, corporate integrity agreements. So I don't know about you. And maybe it's because of, my compliance background and some of the things that I subscribe to as it relates to compliance. But I've been noticing all of the money is getting bigger, the folks getting longer sentences. It's a free for all over there at the OIG, and they're not playing. We've been talking about that for a while. They're not playing with people at all. And even if it's a small amount, they still coming for you. We talked about that as well. Um, so let's talk about the basics first. So a corporate integrity agreement, or CIA, is essentially it's a contract between the Office of Inspector General, or OIG, and healthcare providers or entities. So think of it as a way to get back in the good graces of the Medicare program, that typically lasts 5 years. I've actually seen some that has lasted longer, and I've seen some that are actually shorter, but I guess the average is around 5 years. And so instead of being excluded from Medicare and Medicaid, providers agree to specific compliance requirements. So they are admitting to the charges or whatever they're being accused of. And with that, they are taking responsibility and putting together all of the things. And so they sign off on this corporate integrity agreement. Now, the interesting part is these agreements, even while they're called corporate, they aren't just for big hospital systems. There are also independent providers that receive, and they don't call them CIA for them. They just call them integrity agreements for them. And there are some differences between the two that I noticed. But all of this creates some opportunities for us in the health information and revenue cycle space and compliance, actually. This creates a lot of opportunities for us that I hadn't really thought about before. Um, but I thought, so there was a hospital here. Well, I'm not at home, but there was a hospital in Cincinnati that got hit with a corporate integrity agreement, and everybody went ballistic. And this is one of like our top tier hospitals. You know, everybody loves this hospital. Everybody goes to this hospital if they get an opportunity, you know. And so when they got a CIA, everybody was like, oh my God. And so lightweight, it was looked at as a bad thing. Like, well, you got a corporate integrity agreement, and you know, we don't really want to touch you, and we don't want to be bothered, and you know, it got a bad name. But the people who work there and the people in compliance there were shouting from the rooftops, because again, now the organization has to pay attention to their compliance department, officer, program, etc. There's a lot of things in these CIAs that they're agreeing to, that they have to do, that they have to monitor, that they have to audit, that they have to look out for over the course of the time of their corporate integrity agreement. So for a compliance professional, we've been you say this all the time to your C-suite. You let them know, hey, these are some things, this is what's going on, da 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 da, and they're like, yeah, whatever. But now it becomes kind of front and center, and it's top of mind, and it allows your C-suite to say, oh, okay, well, we need to make sure that we're doing da 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 da. You know, you done signed off, that legal, everybody is on board. They are all eyes on compliance at this point, or all eyes are making sure that they're doing what they're supposed to do according to the CIA. So it makes your job in compliance a little easier. You're not looked at as the police. You're not necessarily looked at as the bad guy. You're kind of looked at as a hero of sorts. Like, you're going to help us, you know, help us get to where we need to be. And again, like I said, folks who are actually working under a CIA all felt that. And then when I thought about that, I was like, well, you know, it makes sense to kind of look for these entities who are under a CIA, because now they get it. Now they understand. They weren't playing with y'all. Somebody may have told, and again, you know whether these are whistleblower cases or what have you, But somebody has said something and now it's out there. You've signed this agreement with the OIG and now you have to do all of the things. So I just wanted to put that under in your spirit as we talk about these things. And let me just ask you, so a question for those who are watching. Have you ever worked with an organization under a CIA? And if you have, what challenges did you face? So if you want to put your comments in the chat, that would be great. Good morning, Crafty Coder, our on the street correspondent. Good morning, good morning. All right, all right. So let's talk about. So one of the first things I looked at with the CIA, and let me pull one up. I wanted to show you specifically. Let me find the one because there are hundreds and hundreds. I put the link to the OIG website where they talk about the CIAs, but then there's also a link on that page where you can get information on here we go, where you can get information on the actual case, so you can find out what was happening, what they did, and then you can also get information on their CIA. Okay, let me see. Okay, so this one, and this happened earlier this year. It was an oncology practice, physician, and reference laboratory to pay over $4 million to settle False Claims Act allegations. This happened. Oncology San Antonio, PA, and its affiliated physicians have agreed to pay $1.3 million, and Core Path Laboratories, PA, has agreed to pay $2.7 million plus accrued interest in civil settlements with the U.S. and the state of Texas to resolve alleged violations of False Claims Act. Let's say they felt like they alleged that the practice entered into an unlawful kickback arrangement with Core Path Laboratories. Core Path Laboratories provided in-office bone marrow biopsy services at Oncology San Antonio practice locations and performed subsequent diagnostic testing on the biopsies. According to the government, Core Path Laboratories agreed to pay $115 for each biopsy referred by Oncology San Antonio and its physicians. And the payments for each referred biopsy were paid to the private practice entities of 3 Oncology San Antonio physicians. The government contended that the payments for referrals of biopsies constituted kickbacks within the meaning of the anti-kickback statute, and that the terms of the written agreement between the parties failed to meet any statutory safe harbor. The anti-kickback statute prohibits offering, paying, soliciting, or receiving remuneration to induce referrals of items or services covered by a federal health care program such as Medicare, Medicaid, or TRICARE. And claims submitted in the violation of the anti-kickback statute may give rise to liability under the False Claims Act, which is what happened here. They also, Dr. Rayo and her practice entity also entered into a 3-year integrity agreement with the U.S. Department of Health and Human Services, Office of Inspector General. So theirs was 3 years that they had to, and Mr. Jesse, you can jump in at any time, that they had to take a look at. Let me go back.
Now, that case you just read, it definitely sounds like somebody dropped a dime.
And they probably did. You already know they probably did. Let's see. No, never worked under a CIA. I think that's supposed to be work
Yeah,
under a
work. Yeah.
CIA, but some of them need a dang CIA. Oh, I did show it on the screen. And she said, "No, I haven't." Okay, okay, all
I
right.
only have once.
Well, I've been adjacent. We were close, but no cigar. But I think I'm in agreement with the people over at the hospital that I knew that they worked. It's powerful. It was like, wow, okay. Because then when you talk compliance, everybody's eyes light up like, oh, okay. Versus the eye roll. Like, really? Is this what we doing? Uh-oh, I don't want that. Okay. Let's share screen again. All right. So here is their integrity agreement. Now, this is all public record. Anybody who has ever, well, I think they cut them off or they drop them off somewhere, but I think they still archive them. So you can always go back and look and see who is under a CIA and how long the CIA is there and all of the things related to them. So before I get into that part, the important piece that I wanted to bring to everybody's attention is the independent review organizations. So keep that thought in mind. So again, they give you all the information about the terms, definitions, all of the things related to their CIA. Now, in section 3, it talks about the compliance program requirements. So they are required under the CIA to have compliance contact. Now, the corporate integrity agreements go is way more robust because again, they're larger entities. They got more coins to spend, and they're required to have like a full compliance department of sorts, and they kind of analyze what those different things are. So this one says within 90 days after the effective date, the provider shall designate a compliance contact. The compliance contact shall not have any job responsibilities that involve acting in any capacity as legal counsel or supervising legal functions for a provider and shall not have any non-compliance job responsibilities that involve billing, coding, or claim submission or oversight of those functions or any other non-compliance job responsibilities that, in the OIG's discretion, may interfere or conflict with the compliance contact's ability to perform the duties outlined in this integrity agreement. The compliance contact shall be responsible for monitoring the provider's day-to-day compliance activities, reviewing the policies and procedures required by Section 3.b below at least annually, making at least quarterly reports regarding compliance matters to the Chief Executive Officer of the provider, responding to questions from the OIG regarding providers' compliance with the integrity agreement, and all reporting requirements created under this integrity agreement. The provider shall report to the OIG in writing any changes in the identity, duties, or job responsibilities of the compliance contact within 5 business days after such a change. So that's one thing. The other thing, they have to have policies and procedures. So within 90 days of the effective date, the provider shall develop and implement written policies and procedures that addresses at least the following: the compliance program requirements outlined in this integrity agreement, compliance with the requirements relating to medical record documentation and the submission of claims for items or services billed to Medicare, Medicaid, or any other federal healthcare program, and the identification, quantification, and repayment of overpayments received from any federal healthcare program. The provider shall enforce its policies and procedures and shall make compliance with its policies and procedures an element of evaluating the performance of all covered persons. The policies and procedures shall be made available to all covered persons. You got to post a notice. So within 90 days after the effective date, provider shall post in a prominent place accessible to all patients and covered persons a notice that provides the name and phone number of the compliance officer and the HHS OIG fraud hotline telephone number as a confidential means by which suspected fraud or abuse in the federal healthcare programs may be reported. Training and education. All covered persons shall receive at least 3 hours of training during the first reporting period. Any individuals who become covered persons after the effective date and during the term of this integrity agreement shall receive at least 3 hours of training within 90 days of becoming a covered person. Training can be completed in person or online, and these training requirements may be satisfied only by the completion of training courses that are submitted to the OIG prior to registration for the training course for review and approval. At the minimum, the required training sessions must include the following topics: federal healthcare program billing, coding and claim submission statutes, regulations, and program requirements and directives relating to the items or services furnished by the provider, the federal healthcare program medical record documentation requirements relating to items or services furnished by a provider, and the personal obligation of each individual involved in the medical record documentation and claim submission processes to ensure that medical records and claims are accurate. Let's see. So, the review procedures. Engagement of independent review organizations. That's what I was talking about, y'all. So within 90 days after the effective date, the provider shall engage an individual or entity, quote, the individual review organization or IRO, that meets the qualifications and requirements outlined in Appendix A to this integrity agreement, which is incorporated by reference to perform the reviews described in this section 3E. So, retention of records, the IRO and provider shall retain and make available to the OIG upon request all work papers supporting documentation, documentation, correspondence, and draft reports exchanged between the IRO and provider related to the reviews described in section 3E. Claim reviews. The IRO shall review providers' fee-for-service claims submitted to and reimbursed by the Medicare program to determine whether the items and services furnished were medically necessary and appropriately documented, and whether the claims were correctly coded, submitted, and reimbursed. That's a claim review. And shall prepare a claims review report as outlined in Appendix B to this integrity agreement, which is incorporated by reference. Of independence and objectivity certification. The IRO shall include in its report to provider a certification that the IRO has evaluated its professional independence and objectivity with respect to the reviews required under the section, concluded that it is independent and objective in accordance with the requirements specified by Appendix A, and the IRO certification shall include a summary of all current and prior engagements between the provider and the IRO. All right, I'm going to stop there for now. And let's talk a little bit about this IRO, shall we? Yes, we shall. So, remember the IRO, they are the external watchdogs, if you will, that verify compliance. And so here's where it gets exciting for us in this field. Again, there's a growing demand for professionals who understand this process. So we've talked about how we may need to pivot. We've talked about how things may change in the world according to health information professionals. We've talked about, there we go. We talked about all of the things. We ain't talked about this yet. So, the entrepreneurial opportunities here, becoming an IRO consultant, starting your own IRO business, consulting business. How about that? Developing corporate integrity or integrity program compliance training programs, particularly with these small organizations, with these one-off providers. Creating documentation tools and templates to help these providers, and even offering mock audits and preparedness assessments for folks who may be looking at the possibility of getting a corporate integrity agreement or integrity agreement. What y'all think about that? Is that something that, again, in the spirit of entrepreneurialism, that you can kind of take a look at and see if uh, you fit the bill? You have the skill. I'm sure if you are a certified coder, you definitely have the skill. If you are out here auditing, again, that we've talked about, what is necessary and what's needed to pivot into auditing, here again is an opportunity for folks to kind of put their toes in that space, if you will.
But this is just what we were talking about earlier today, like how there's a lack of information and how people don't know how to make the HIM industry work for them. Because if someone, I mean, you just mentioned like 3 or 4 different business opportunities,
Mm-hmm.
and you don't have to do all of them. You could just pick one.
Mm-hmm. And that can be your niche, and that can be the
Hmm.
thing that you set yourself apart as, and then
Right.
you create what is special about you, what put your branding together. I knew somebody. What is special about you, what is unique about you, and the services that you provide to these people again. And we've talked about this over and over again, because y'all used to just y'all I saw y'all roll y'all eyes at me when I would talk about compliance, and especially with these small providers. And I'm like, but they're not exempt from this. They are just as culpable as anybody else if they're found guilty of committing fraud and abuse and all of the different rules and regs that the OIG has set up. So while they may act like, oh, well, I don't know, and they may legitimately not know, you're supposed to know, and you're supposed to put together the people in progress and in place to do that. The one thing I
But
will say,
I,
go ahead.
I just want to jump in because you said a key phrase, supposed to know. Because every time we talk about compliance, and it, I have I've only worked, if I could honestly, I only worked one place that had a real compliance department, and it's just compliance is just as bad as offshore coding. I mean, it really is. Like these people are terrible. They really,
Must have
really
just been
are.
blessed with some wonderful structures and organizations who, while again we would get the oh my god, here they come to police us looks, but folks understood the importance of the role and understood the importance of implementing, and really understood that compliance isn't just about the compliance officers. Compliance isn't just about the compliance department. Compliance is about everybody. Everybody is responsible to make sure that they're doing what they're supposed to do compliantly. And so making sure we had training. Most organizations have annual training. There was always a compliance component to that annual training. There's always training, new employee orientations. We were always at the table with new employee orientations. We were at the table with new provider orientations. So that was, and again, it wasn't just one organization I was with, it was multiple organizations that I have worked for. So I've just been blessed to be around folk, because I would probably be like, what in the whole world is going on if nobody understands and knows? And y'all been billing the federal government over the course of years, and don't know about compliance. I don't understand, Lord. Just if you're working for these small entities and organizations, please make sure that they understand what they're doing. Please, somebody help them. Help them.
We have a question.
I see. I'm looking. Hi, Dr. Jasmine. How are you? How do certified professionals who want to become entrepreneurs provide success metrics from current or past roles to ensure potential clients that they didn't just collect letters behind their name, but also have proven results? Great question. So, and we're going to dive more into that in our meeting after the meeting. But if you take a look at the CIAs, it gives a specific guidance on what the independent review or the IRO person needs to have. It gives specific guidance on the documentation that needs to be part of those reviews. And so it gives you step by step what is necessary. And it tells you specifically what qualifications that the person needs in order to function. So you kind of have a kind of blueprint right there that helps you to decide and or determine whether or not this is something for you. And so if you have worked in compliance or you have audited records or you are a certified coder, then you need to craft I hate to steal from the government, a capability statement to say these are the things I'm capable of. This is what I've done. This is how I've impacted XYZ organization. Something to the tune of, as oftentimes you want to have numbers and you want to have, metrics to say, okay, I assisted in saving this organization from X amount of dollars by making sure that we were, and I'm trying to do this off the top of my head, but making sure that we coded some high level sepsis, let's say sepsis, because that's something that, is always in the news. That we were responsible in providing education, training, and coding of sepsis correctly in our facilities. Da 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 da. So you want to tell more of the story of what it is that you have done in those roles. Did that help? Did that answer your question? Okay. I'm sure she'll come back. So again, these are some things to think about. Like, while you're wondering, okay, I'm sending out these now. Let me just say, this may not be for the brand spanking new person. This may not be for this not your wheelhouse. If the ink is barely dry on your certification. No, this is for people who, oh, oh, absolutely. Yes. So, well, I haven't coded since the Bush administration and haven't been in a traditional HIM department in decades. I just like to learn about opportunities outside the box to share with educators. Absolutely. Absolutely. Because again, this is entrepreneurship is an outside of the box realm. And we like to actually focus on that because, folks are running into gatekeeping, if you will. They're running into all types of roadblocks and hurdles into getting into these higher level positions. And then I told somebody the other day, there's only so many hospitals. There's only so many hospitals and so many compliance or HIM departments or HI departments or revenue cycle departments. Yeah, they, depending on the volume of patients that they're seeing, depending on that system, if they have multiple entities, if they're an integrated health network, so you have some additional opportunities to work through and look at other areas, not just acute, but also physician and home health and long-term care, all of the things. So you have more opportunities. But if you don't, and you're just, in one entity, there's only one shot, you're stuck, if you will. The one beauty that we do have is the opportunity to work remotely. So that kind of widens the net a little bit. But then again, you still have to come prepared and know how to market yourself and know how to confidently and accurately explain what it is that you can do, have done.
I totally agree, and I think that when it comes to
I have a brag
entrepreneurs,
book, emails, reference letters, etc., that I've collected over the years. Absolutely. Go ahead. I'm sorry.
so I think when it comes to entrepreneurship, like there's also, it's just like everything else. Like there's levels to it, and you have to know where to start. And I mean, I really think that this IRO is really something for some that could really be a good fit for some people, because especially if you're starting out, like if you have, and there are a lot of coders who have been working in auditing for years, and the thing about an IRO and these integrity agreements is you have to start off small. Like, you're not going to, like an individual person, you're not going to get a contract with the hospital system. You need a team to take on a hospital system because they have thousands of records, and there's this, the volume just won't allow itself to have just one person. But this practice that just got in trouble, they could definitely use your help.
Right. And so the smaller ones, because there is a cap on the number of records that they have to audit, at least initially, until they find a problem, and then that may explode. But I believe I saw somewhere in the CIA or integrity agreement for this particular one, of 100 records. So, that's not a whole lot. And I don't know if that was, I believe that was 100 records annually. So again, it may expand depending on the findings, because then the practice may say, oh well, we see we have a problem, let's drill down on what this particular issue is, making sure we are stopping that bleed, providing education, and then continuing to monitor and audit that particular situation. So opportunities may, exist, or it could just be a one and done, like you're on quote unquote retainer for them, just to come in and do their review, because again, they have supposedly their compliance function person who, while it's not responsible for any of that, has oversight and should be able to say, hey, I'm seeing a problem, or I'm getting calls about a specific issue. I may have to tap into our IRO to say, hey, this is something else that, we may need you to take a look at. Can you take a look at this? Because again, it's independent, it's outside of the organization. But yeah, this right here, to me, I thought was just a gold mine of sorts. If you're looking to kind of stretch your entrepreneurial wings to see, hey, is this something that maybe I can do? And then maybe you have a niche. So say, and this was an oncology practice. Say you have a niche. Say you work specifically in oncology. Well, then, like I said, we'll talk a little bit more about, how to go through and kind of look for opportunities that's already given to you from the OIG. It's got small specialty practice are definitely my niche. Mm-hmm. Yeah. So I thought that was when I was looking through my mail on from the OIG and all of the different people that have been found guilty of fraud and abuse and all of the various things, I was like, wow. And then it hit, they updated their corporate integrity agreements, and I was like, well, let me take a look over here and see what's happening. And then voila, look at here. I see opportunity after opportunity after opportunity. And sometimes the best opportunities are the ones that you make for yourself. And so, again, here's a way to make that opportunity for yourself. So, who's interested in learning more about becoming an IRO consultant? Huh? Type IRO in the comments. Did I pique your curiosity? Oh,
That really could be a good look. It really,
that's
really
a good
could.
look. Yes, yes. And then, we always talk about, even from the government's perspective, well, somebody has to receive this information. They have to do their own kind of auditing. I mean, there's plenty of opportunities out here. It's just a matter of knowing what opportunities exist and how to tap into them.
Uh,
And hopefully
Tanika
we
has
have,
a, Tanika has a question. No.
no. Does the CIA trump any pending civil charges? No. Uh-uh. And then also, there and again, we'll talk more of for those who are PRNT sippers when we look at the meeting after the meeting. Um, there's additional penalties that come with not abiding by the integrity agreement that you sign per day, like thousands of dollars per day until you get whatever right. So again, the incentive is to make sure that you're doing what you said you were going to do within that 90-day time frame, and then annually for like these reports and such. So yeah. So hopefully I gave you something at least to chew on, as you think about, what you might want to do, how you might want to get involved, um, to to parlay to I don't know if I hear the dog to parlay to parlay your credentials and expertise and knowledge into something something else, something that you control. How about that?
Definitely. And it's definitely a need out there.
Hmm.
Definitely.
And again, this kind of creates multiple service niches for healthcare consultants and educators too. I think the educators right now, this is an opportunity um, to assist in. Again, I'm thinking primarily about those small um, practices that you know the wife is sending out the bills and greeting the
And
patients and doing all of the things.
because this, like, integrity agreements, especially for smaller practices, that's a lifeline before your behind ends up excluded.
Exactly.
You
They
know,
trying to
so
help you. They
right.
trying to help you. They trying to help set you up. Like I said, it's a get back into the good graces. Like, okay, yeah, you
Hmm.
did this. Yeah, you made this mistake. But let's show you how it really is supposed to be done. Let's show you what it is that you need to do. Um, let's kind of handhold and walk you through what how this program is supposed to operate and how are you supposed to document and submit your claims and all of the things, because we're going to look at you and monitor you. We got you for the next 3, 5, 10, whatever, however long your integrity agreement is. We got you. And so here's actually an opportunity to ask questions to make sure that you got the right people in play doing what it is that they're supposed to do. All of these things. Um, but yeah, it's a good thing. It's a good look.
It really, really is. I
Yeah.
mean, that look, that could be somebody's 2025 right there.
Hey, hey, hey. And even like you said, even starting out small, just investigating and see.
And you, the hardest part of a lot of this is finding clients, but you have a dedicated referral source.
Every month. Every month. You like get your system in play where you're going to reach out and touch and speak and see, and hey, let me share. Remember, I guess people still. I remember years ago. Everybody's probably getting them via email now, but you would come into the office and it would be a gazillion faxes from everybody in the world who done sent you faxes overnight about whatever it is that they doing or selling or whatever. Um, yeah, here's an opportunity. And unfortunately, it may be a lot of cold calling, but at this point, these people nervous. They probably like, what can you do to help me? Please, somebody. We have no clue where to even start or where even to begin.
Or how to even find somebody. So if you know they're in trouble and you reach out and you provide them a solution, they're going to think it's Christmas.
Christmas. Like my clients on the front end, when we're developing and starting, I'm like, you need to put together some compliance program in play. And this is why. And that's when I do the education. And so that's kind of an upsell for me. Yeah, I'll do all of these things to help you get where you are, but the upsell is, and I'll also help you put together your compliance program, especially if you don't know. And folks out here just flying by the seat of their pants, thinking, okay,
They
there's
really
money out here to
are.
get. There's money out here to get. I'm trying to get it all, but can you keep it all? And that's where we come in to try to help you keep it all.
And you want to get to them before they start going to these Facebook groups asking all these questions for people who don't know either.
Oh my God. I know y'all enjoy over there in them Facebook groups.
I mean, I had no idea. I'm like,
I don't know how y'all do it. I'll be like, you know what? That's like, and no shade to anybody because I have plenty of family members who do it. But like the ratchet TV that I like to call it. Like I can't. I just it's too much. Like y'all watch this all the time. That's the same thing in these groups. I'll be like, y'all looking at this all the time. However, I do understand the value of it because there I see gems in that too. Just after having conversations with y'all, like, and so y'all ain't tap somebody on the back end, like, sweetie, let me help you do so and so, or let me offer you whatever. So I get it, even though, you know, folks may be like, somebody offered me so and then they ban y'all out the group. But there's an opportunity. There's an opportunity. Mm-mm-mm. She said, I send it in the mail. Talk to their pain points. Have you seen this? Do you struggle with that? Absolutely. And then, we talked about how AI is a tool for you. Put AI as a tool for you. Attach your resume into whatever AI tool that you use of choice and allow it to craft your talking points. Allow it to help you put together what your branding is, what you come to the table. Let it highlight for you what you've done. So you're not stealing from, no, it's about you. Put your resume in there. You can attach documents to your AI. Attach the documents and let it work for you. You say join the Facebook groups and DM them. I have a few clients from in there. They so damn loud. Yeah, I'm just saying because sometimes folks have rules in their Facebook group, and that may be against the rules. So be careful that 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 group doesn't have that, and you don't get caught up. You want to be compliant in the Facebook groups.
definitely.
Definitely. All right, y'all. All right. Well, hopefully this was an episode that gave you something to think about, gave you some food for thought, allowed you to think, well, wait a minute. Hey, here is an additional opportunity that, if not for me, maybe it's someone you can share it with. So, yeah, remember sharing is caring. Sharing is caring. All right. And remember, compliance isn't just about following rules, it's about creating sustainable, ethical healthcare businesses, something that we all can do. Right? Right.
Sounds like a slogan.
Don't it? All right. All right. Um, let's see. Stop the screen share. Okay. There we go. Right. So, are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the PRN sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. And here's what you can expect as a valued member of the PRN sippers. Exclusive healthcare insights. Gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, revenue cycle best practices, and we even have like our little entrepreneurial folder in there as well. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And my favorite, community connection. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So by supporting us, you're not only advancing your healthcare knowledge and career and entrepreneurial endeavor, but also contributing to the success of the Professional Reimbursement Network LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you in advance for considering becoming a member of the PRNT Sippers. For the cost of 2 cups of tea or 1 cup of that one kind of coffee, you can join the community. Check out the link in the description of the video or go to bit.ly/the PRNT Sippers. Again, that's a bit.ly/the PRNT Sippers for more information. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. I sound like an infomercial for real, don't I?
It's true.
Yeah, I do the announcements for my church. So, yeah, I have a lot of practice. All right, y'all. All right, all right. Well, thank you again for joining the Saturday Morning Tea or checking out the replay. Let me ask, was the tea spilled today? Put the teacups in the chat if you got a little tea. If you got a little tea. Yes.
Absolutely.
Now, before we sign off, I got a special request for you amazing viewers out there. If you found this episode helpful, don't keep it to yourself. Share the knowledge with your colleagues by hitting the share button. And hey, why not subscribe to our channel while you're at it? That way, we'll never miss a drop of our health information, compliance, revenue cycle, and medical coding tea. Also, check out the Coding Nurse channel. He's there with gems as well. So if you got thoughts, questions, or experiences that you want to share about today's topic, we'd love to hear from you. So you can continue to drop comments below, and let's keep the conversation brewing. And if you enjoyed this episode, give it a thumbs up. It helps more healthcare professionals find our content. Remember the Saturday Morning Tea? We're all about building a community of savvy, informed healthcare professionals, right? So again, like, share, subscribe, and comment. Let's grow this community together. Yay, I see the teacups. Yay. Yay. All right. So again, this has been, oh, look, I'm already at the top of the hour. This has been a great session today. See you PRET sippers at 10:15 a.m. And remember, be safe, be kind. Oh, I'm sorry. Mr. Jesse, did you have any closing thoughts? See, you've been missing, so I done forgot you that quick. Do you have any closing thoughts?
The only closing thought is I'm going to end like Oprah when she gave out the car. When she gave out the cards, you get an IRO, you get an IRO, you get an IRO.
You better sell it. So again, this has been a great session today. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a great weekend.
Bye-bye.